What is Valium? Valium is a form of a benzodiazepine, which is a class of tranquilizers that were once used for treating anxiety or panic attacks. Medical professionals are trying to stay away from these medications because they're very long-acting, they stay in the body for a long time, and they can have a heavy-duty dependency where a person, if they were to stop them, can go into withdrawal and feel very uncomfortable. The other problem is it takes a extraordinary long amount of time for a person to get over the withdrawals of Valium. Instead, a gentle wean is needed because if they suddenly stop it, there's a high potential for serious complications like seizures or delirium tremens and possibly death as a complication of sudden cessation of benzodiazepines. So Valium, it can be used very good for short term, but not for long term. It's no longer the standard of care for anxiety or panic attacks, and it can develop a pretty serious withdrawal syndrome, and it can also take quite a long time to wean off of it to reach safe levels, so is no longer used as a first line of treatment. That being said, some people abuse Valium for its anxiety relieving effects, and the withdrawal syndrome needs to be tackled by a healthcare professional. I do not recommend somebody doing this on their own. They need to go on a slowly weaning dose to avoid the complications. And finally, it does take a long period of time to wean off of Valium because of its long-term effects. It's absorbed by the body and held on by the body for a long period of time, and so it takes a lot longer than a normal drug of abuse to finally get through the detox and withdrawal stages so that the person is safe and can go on to live their normal life. Why is Valium addiction bad? This is an older drug. It's in the class of something called benzodiazepines, and these were once used as first-line therapy for anxiety or panic attacks. Now, in small doses or for a short period of time, these are still used, and it's okay. It's also used for our people who are withdrawing off of alcohol to prevent seizures and other complications. So for a short period of time, like 2 to 3 days or even up to a week, Valium is acceptable. But over the long period, Valium is not a good medication, is not indicated anymore for anxiety. There's much safer drugs to take that in overdose they're safe, whereas Valium, if a person overdoses on that, it can be potentially fatal. And it has a lot of side effects associated with it. It's a lot like alcohol in the way that it can induce behavioral changes, severe agitation when a person is withdrawing from it. And it's also a very long-acting medication, so to withdraw off of it takes an extraordinary amount of time compared to other drugs of abuse. So in summary, Valium is a very dangerous drug if taken in overdose. If it's taken in short doses, it can be safe, however, but if a person has been abusing it, it takes an extraordinary amount of time to slowly be weaned off of it to the point where a person is safe and feeling normal. How much Valium can lead to an addiction? If it's used as prescribed and used sparingly, it may not lead to addiction at all. If the shorter period of time it's being used for, the better. So anything up to a month. After a month, or if there's escalated doses, like higher than that has been prescribed, then that is probably the higher risk period, so somebody can become dependent. So what would happen is if they suddenly stopped it, they would start feeling very anxious, very agitated, which are clear-cut signs of withdrawal. This is the major issue with Valium. It's not a good medication to take in high doses or for extended periods of time because it is a significantly uncomfortable withdrawal syndrome. And it can take a long period of time for the person to be weaned off of it, and overall it can cause, in general, just a lot of agitation, agony for the person who's going through withdrawals, a lot of agitation and fear. So this is not a good drug in any capacity to become dependent on. However, if it's happened, it's really important to get in touch with your healthcare professional to let them know what's going on so they can slowly wean you off of it to the point where it's humane and to give you compassionate care. How to avoid a Valium addiction is to take it as prescribed or less, to minimize the dose So a typical dose is 5 to 10 milligrams every 8 hours. That's generally the maximum, but I would suggest to try to minimize as much as possible how much you use. So the safer way is 5 milligrams maybe every 12 hours. And then to avoid escalating the dose, it's when we escalate the dose beyond that has been prescribed that a person can develop dependency and possibly a full-blown addiction. When I say full-blown addiction, I mean that they are hiding their use, they're lying to others, deceiving others, they might be in denial that there's no problem at all. So Valium is potentially addictive, and this is one of the more serious medications to be addictive to, that it can cause major problems in sudden cessation. It can also cause a protracted or prolonged withdrawal period, and it needs to be slowly weaned. The way to stay safe on it is to minimize the dose, both in the quantity taken but also in the interval, to try to increase the amount of time in between subsequent doses of the tablet. How to overcome a Valium addiction? This is considered a high-risk time. This drug itself is very potent, and if it stops suddenly, it can cause problems. That being said, if a person's been only using it for a couple days, then there shouldn't be any problems. But if it's been used for over a week or so, and if it's in higher doses, anything above 10 milligrams 3 times a day, it can cause a significant withdrawal syndrome if they stop suddenly. And this withdrawal syndrome is very dangerous because it can precipitate seizures and something called delirium tremens. It can be potentially fatal as well. So treating a Valium addiction, especially if it's a long-term one, absolutely should be done at the discretion of a healthcare provider. They can provide safe quality weaning off of it instead of sudden cessation. There's other medications that are more short-acting that could be used as temporizing measures to avoid the withdrawal, but to try to slowly but surely reduce the dose. And over probably several months of someone who's had a long-term addiction, they eventually can get off this medication. So Valium is in a class of drugs that is considered dangerous. These also take a very long time to wean off of safely, and this should be done at the discretion of a healthcare provider.